Welcome to the Mount Pilgrim Missionary Baptist Church Network, where we are building faith and transforming lives, where our senior pastor is the Reverend James I. Perkins.
Well, good morning, and welcome to Mount Pilgrim Missionary Baptist Church. We are so excited about our guest this morning. Actually, we're excited about the podcast and what we are trying to accomplish here. So without me talking a lot and further ado, I'd like to just introduce Miss Ann Martin, who is the director of our Caldwell County Health Department. And along with Miss Martin, we have Miss Paige Counts, who is the public information officer of Caldwell County. So thank you, ladies, for being present or being here with us today and on our podcast. And before I get started and get turned loose, and Douglas give me a cue to cut it off, I'm just going to turn it over just briefly to Miss Martin. If you would just introduce yourself and tell us about your 5 husbands or your 10 children or whatever. So if you will at this time, just introduce yourself and tell us who you are.
Thanks for having us here today. We appreciate coming and talking to you guys. So briefly, just about me. I didn't have 5 husbands or a million kids, but I do have a small little dog, and today's her birthday, so it's exciting. But I've been at the health department. It'll be 8 years in May, and I've been health director. Well, I was interim before health director, but that'll be 3 years in June. And before that, I did health education. So health promotion and prevention's really important to me. Yeah. Before that, I worked at Appalachian District Health Department in Wilkes County. So health department and public health is very near and dear to my heart. So reaching out for the community is what I love best.
Very good. Now, I know that the health department, or you, wear many hats. I mean, you're really involved, obviously, to the county and to the surrounding areas. But can you tell us just maybe some of the hats that you wear, or how is the health department reaching out or helping in the community?
Sure. Well, right now we're hands on deck with COVID, and I know we're going to talk about that just a little bit, but besides that, we have many departments. So we have, of course, our clinic. We do have immunizations, where we provide immunizations to small kids before they go to school. We do flu vaccines, we do any kind of vaccines. We also have an STD clinic, we have a maternity clinic. We also have a WIC department, and that's women, infants, and children. So for mom and baby, so they can get good nutrition. We also have a dental department, so that's for children mostly. We do have environmental health and then child health. So we do have a array of different services for the community.
Very good. How do you receive these people? From a referral from their doctor, or what do we do to get seen at the health department from some of the departments that you just mentioned?
So, well, for dental, for example, a lot of them is for referral from different agencies, or we just build our clientele like other primary care. Our WIC department is by referral, whether it be from their doctor or whether it be from our clinic. So it just depends on what area.
Okay. Now, I'm assuming that you do have doctors on hand, or doctors called in, or do you have doctors readily there at whatever clinic it is?
We do have a doctor. He's our medical provider, or our medical director, Dr. Picton. Then we also have an FNP and a PA there. So we do have 3 providers on hand and several nurses within our clinic.
So these guys or ladies are full-time employees of the health department.
Exactly.
Okay. Now, and I know this, and maybe this is crazy, but where is the health department located? I know we got the big building out there. How are they located? Where?
So, of course, the building is beside the sheriff's office. We share a building with DSS. So once you go to the building, you'll go in the right-hand side, and that's where the health department's located.
Okay. Now, I know that there are a lot of people that can't afford the clinic there, or different departments, is there a fee, or how do you charge for clients to come in for whatever department they're coming to?
We do charge, but we do have a sliding fee scale depending on basically their income or, you know, whatever they can show. So we do have a sliding fee scale. So if they were not able to pay, they may slide to zero and wouldn't have to pay anything.
So are your fees connected with the salary? Your fees will be determined what your salary is, or do I have to, or would I need to bring a financial background, a financial report to receive medication or receive attention? Or
They would bring a proof of any kind of income. So
Okay.
the salary, yes, or if they did not have any kind of income, they would just need to bring proof of how they pay their bills or
Yeah.
or something so we can help them out.
Yeah. Well, that's good, and I think that's only fair because, believe it or not, there are people that would take advantage of the services that you guys provide, and maybe ruin or take some service away from somebody that needs it. Have you ever experienced that, or how do you know?
Not really. Most people are willing to pay what they need to, or if they really
Yeah.
can't, you know, it'll show that sort of thing. But
Mhm.
most people in Caldwell are really upfront and willing to help. So.
Okay. I want to get to some of the easy questions now about the elephant that is in our community, and that I mean the COVID. And I know that the health department and hospitals, we are guided by the CDC guidelines. And how are you guys affected, or what guidelines are you applying to for with the CDC?
So right now we're really hands on deck with vaccinations. You know, our numbers are really declining, which is we're very thankful for that. Talking with Dr. Lowry at the hospital, it looks like we've reached our peak. So hopefully our numbers will keep declining. Hopefully our deaths will start declining, hospitalizations and things like that.
Yeah.
So whenever we had, like, let's say those days where we had 100 or 150 people per day, cases, we've reached out with the state and we partnered, and those people were contact tracing. And what that means is they called all those positive people and just asked them the general questions. How are you feeling? Where did you go? Who are your close contacts? And so that's really taken a huge burden off the health department, just because at one time, everybody in the health department was calling those positive patients besides doing their normal job.
Right.
So the state is helping us with that. And we're also right now, and I know we're going to get to vaccinations, but the community college is helping us administer vaccines. And so we have a lot of partnerships right now with the community.
So you're in constant contact with CDC or Dr. Lowry and UNC Hospital. How do you guys do that? Is it regular meetings or by phone, or how do you make contacts with each other saying, hey, look, we are receiving a lot of calls, or we have a lot of people? How do UNC, what's the partnership?
We have a call every day at 3:30 with the hospital.
Okay.
And that call really is to talk about our numbers. Let's get their numbers, let's get our numbers. And a lot of that's for the report for Ms. Counts, just so she can do her press releases every day.
Okay.
And if there's any issues in between, we bring it up at that time. But if there's something that's urgent that needs to be addressed at any point, we just pick up the phone and call. So we also have a skilled nursing facility call, and that's on Tuesdays. We also have a school call, and that's every day at 3:45, and it's the same, reporting numbers, but if there's any issues, report that too. So.
That is another good question, I think, or another good conversation, maybe not for this, but the schools. And I know that the schools are on time, and different ones are in and out. How do you communicate with the schools to determine, well, we're going to go back to school, or who makes that decision when we return back to school, and how does the health department do that or have a part in that?
Well, we do have a part. I went to a couple of their board meetings and talked with Dr. Phipps. but it's mostly the superintendent and the Board of Education that makes that decision.
Okay.
I just kind of give them a little bit information of what I know.
Yeah.
But I'm always in constant communication with Dr. Phipps, and then he'll relay any information that he needs.
Well, that's good. That's good. The vaccinations. How are we still at the point of 65 plus, or how are we doing with that? Have we made an inroad to 65 plus, or how do you do 65 plus and maybe essential workers? And I know what I was going to ask. Should not ministers, pastors be added to the essential list? And then first of all, how do you do that? Is it 65 and then the essential workers and then who?
Yeah, so right now the state's got it as phase 2, and that's 65 plus. That's everybody. So anybody that's over 65 can get vaccinated.
Okay.
Ms. Counts has made this great website, and it's vaccine.caldwellcountync.org, and that's how you sign up to be on our waiting list.
Okay.
Health department staff are weeding through the waiting list, calling people and making appointments. So that's 65 and older. At the beginning it was just 75 and older, and then the state changed it to 65 and older.
Yeah.
So once we get to phase 3, that's going to be your essential workers. And ministers would be within the essential workers. And then I believe they're starting that at 50 plus with chronic conditions, if I'm not mistaken. And then there's 2 parts to the phase 3, and then it'll be below 50 plus.
So with 65, it is with a chronic condition, or below 65 with a chronic condition that you would be qualified for.
Right, with the phase 3, but right now 65. Yeah, with 65 plus, it could be anyone.
Oh, okay. So we have not gone under the 65 yet, outside of a chronic condition.
Right.
Okay.
Yeah, we're still in there. We have more demand than supply right now, and so we're asking for more vaccines from the state, and so we can get through those lists.
So you say you're asking for more. Do we have the adequate supply now for the vaccination for 65 plus?
Well, right now we're only guaranteed from the state 300 a week for first doses. So we've been asking for about 2,000.
Yeah.
So I don't think it's an adequate supply because we need more vaccine.
Right. Yeah.
But it's not there. So they're sending us what we can get.
Yeah. Well, I don't think it'll be an adequate supply.
Yeah.
We just got to keep pounding and keep asking for more and more and more, and that's good. Lastly, vaccinations. Who there at the health department administer or gives the vaccination? Who is set around qualified to do that?
So we have registered nurses, and they're giving the vaccinations. But like I mentioned, we've partnered with the community college, and the nursing students and med techs are helping us. So they're drawing up, they're giving the vaccines, they're doing a lot of the vaccinations.
Oh, okay.
And then we have data entry people who, when someone comes to get their vaccine, they either already have their card for second doses, or they're making sure they're in the system for the state and getting everything done. So there's a lot of hands in the pot.
You know, this would be me in the early beginning of this. Do you have counselors there, or someone there that is attended and just don't like shots, afraid of needles, like, you know, Rev Perkins? Is there somebody there that say, oh gosh, there wouldn't be somebody there to sit and console a person, or you hadn't had that yet?
Well, we've had a few, but our nurses have been doing that.
Yeah.
We had one lady, she just kind of turned all the way around and said, is it done yet? Is it done yet? But it wasn't even for her. It was for, I believe, her mother. So we've had a few people, but the nurses have been very great. We had one lady who was crying, and it was an older lady in a wheelchair. And one of my nurses went up to her and just held her hands and said, you know, what's your name? Just kind of talked to her before it was done with. So our nurses have been very great.
Good. That's where I needed to be then, because I am terrified. That was my only drawback with those needles.
Yeah.
But thank you guys and for being here. But one other question, and maybe Miss Count, or maybe you can, news releases. How often do you do that, or where are these news releases sent to reach the public?
So Ms. Counts does the news releases every day, except for the weekends. She does them Monday through Friday towards the end of the day. They might come about 4:30 just to make sure our numbers are in. She sends them to all the media.
Yeah.
She sends it to basically all the community members to send everything out.
Okay. Well, ladies, I'm telling you, I really appreciate you guys taking time out from your busy schedules and come here. And I think this is very important for our community to share with our community what's going on and how things work. So thank you guys so very much for being here. And I hope that we can do this again sometime soon. And maybe the next time, Miss Morton, we'll switch roles and put Miss Camp here under the light and see and just and just purge her mind and just go from there. But again, thank you guys so very much.
Yeah, thanks for having us.
Thank you for tuning into another exciting segment of Straight Talk, where we get straight to the questions and answers that you would like to ask some of the leading people in Caldwell County. We look forward to bringing you podcasts that make an impact in our communities. So tune in every Thursday at 7 o'clock, where we will bring you Straight Talk. We want to keep you informed on activities that are going on within our communities. Be blessed. We will see you next week.